Good morning, everybody. It's Dr. Rahul here from YourGPCircle. Hope everybody is doing very well. As you know, we're in the month of Movember, and this is the month where the spotlight is firmly upon men's health, which often gets neglected. And that's not because of people in general, that's purely because men sometimes are not very good at looking after their health or giving it the due attention it requires. So just quickly in this video, I want to touch upon 4 key areas that we touched upon last year during Movember as well, and we've reshared some of those posts this year, and also we've done some new social media content this year as well. So the first one is prostate cancer. So prostate cancer is the most common cancer in men in the UK. Okay, so that's a really important fact to kind of grasp, that this is not something which is rare. If in fact affects a lot of men, more than you would imagine. Some of the symptoms which may represent or indicate that there's a prostate problem going on would be urinary symptoms, such as having to rush to go for a wee. When you get to the urinal, then there's hesitancy, so you've got to stand there and wait for the urine to come out. The flow could be poor. There could be dribbling afterwards, and also frequent waking up in the night time. So these are just some of the symptoms which may indicate that you have a prostate problem and you need to get in touch with your GP. The second problem is testicular cancer. So when we're looking more at younger men, so testicular cancer is the most common cancer in young men. Okay, and this is why it's really important that young men get into the habit of checking their testicles every month. Okay, so the time when we recommend is when you're having a shower. Just get into the habit of having a quick examination of your left and your right testicle. And the real key thing here, and the real key reason for doing this, is so that you become familiar with what's normal for you and your testicles. Because then down the line, later on, if you develop a lump or the size of one of your testicles starts to increase, you will know, because you'll be able to compare it to what it was like last month or the month before. So really important that young men get into the habit of checking their testicles once a month in the shower, so that you know what's normal for you and therefore what may not be normal in the future, so you're in a position to seek help early on. The third thing is something which doesn't really get mentioned too much, and we see that men often ignore this problem, purely I think probably because they find it quite embarrassing, and they don't discuss it with medics enough, and they don't discuss it with their partners enough. And that's erectile dysfunction. Okay, so, and often what we see is men just kind of resort to buying some medication online or from their friend down the pub to try and resolve the underlying problem. Not the underlying problem, just to resolve the problem of erectile dysfunction. But actually the really important thing here is by taking that approach, you run the risk of missing a serious underlying cause for that erectile dysfunction. Sometimes erectile dysfunction can be due to stress, anxiety, performance anxiety, marital distress, and so forth. But a lot of the time, especially in older men, there is an underlying medical cause for it, which is something like diabetes, high blood pressure, high cholesterol, a prostate problem, and many other things. Sometimes it could be medication that you're on, which could be causing the erectile dysfunction. So please, if you are suffering from erectile dysfunction, number 1, don't suffer in silence. Number 2, don't just buy some tablets off the internet or from your friend down the pub. Please do discuss it with a GP too, because it may well mean that you need some more blood tests or investigations to make sure there's nothing more serious causing the erectile dysfunction. And last of all, probably the most important actually, is about suicide in men. Okay, so just generally speaking, across men and women, the rates of suicide in the UK are going up, or they have gone up in the last year. When we drill down on this further, what we will see is actually the rate of suicide is highest in middle-aged men. Okay, so the number of men in the middle age group, say 45 to 50 or 55, is actually highest across any other age group, whether that's male or female. And I can vouch for this. You know, we see a lot of men present to us with anxiety, depression, panic. And obviously, you know, we try and spend time with them to kind of drill down and help as much as we can. And it's great that those men do come and see us, but there are many men out there who go through these tough times and they don't seek help. and they suffer in silence, and eventually, unfortunately, they kind of take to the last resort, which is committing suicide. So that's something that obviously we need to raise more awareness about, that there is help out there. Don't suffer alone. Speak to somebody. Everything that you speak to us about as GPs is in full confidence. So the 4 key areas are: number 1, prostate cancer, which is the most common cancer overall in men in the UK. Number 2, testicular cancer, which is the most common cancer in young men in the UK. Number 3, erectile dysfunction, because it's not that simple as buying tablets. There is a lot of the time a serious medical underlying cause causing the erectile dysfunction, so we don't want to miss that. And number 4, mental health and suicide in men. Please seek help and reach out to those who you think might be suffering. Have a great day.